Hi, I am Dr. Stalin Ramprakash. I am one of the pediatric hematologist oncologists working at the Aster CMI hospital. Today I am going to talk about bone marrow transplant. First we'll start with what is bone marrow. Bone marrow is a sort of material which is inside the bone, which is like a factory which makes all the red cells, white cells and platelets in the blood. So whenever there is a problem in the bone marrow, then we do the treatment called bone marrow transplant, otherwise also known as stem cell transplant. So bone marrow transplant, how we do it and why we do it, I will explain to you. Bone marrow transplant is done when there is a diseased marrow, defective marrow or non-functioning marrow, where we want to replace the stem cells which are not working from the patient with new stem cells which may be working. So the bone marrow transplant, we sort of classify them into two main types, which is called autologous transplant and allogenic transplant. Autologous transplant is when you use the patient's own stem cells to correct the problem. Most of the time this is used in cancers where the normal amount of treatment is not sufficient in solid cancers. So one of the side effects of giving large amount of chemotherapy is that your bone marrow will fail. So in order to avoid this, we collect the patient's own stem cells first and freeze it or store it and then give the medication and then give the stem cells back to them so that we can give a higher dose of chemotherapy. Another situation where this may be used is some severe autoimmune conditions where we want to sort of switch off the immune system and reset the whole thing. So that is also another situation where we will use autologous transplant. Majority of the other transplants are allogenic transplant. So when we say allogenic transplant, it is done from somebody else. So either it can be a matched brother or sister, or it can be another unrelated person, or in some such situations where the transplant is necessary but you cannot find a donor, we may use from either parent or sibling who are half matched, which we call as a haploidentical transplant. So what are the conditions in which we do the bone marrow transplant? So I already told about the diseased, defective and non-functioning marrow. Diseased marrow is when, say for example, there is a leukemia. Most of the leukemias will be cured with chemotherapy, but there are a group of leukemias which may not be responding well to the chemotherapy. In those situations, we need to do a bone marrow transplant. Or defective marrow. So when there is a genetic condition, for example, conditions like thalassemia, sickle cell, where the patient is born with a genetic defect, then in order to correct the genetic defect, we cannot use the patient's own cells, so we use somebody else's stem cells, then which will make the normal cells, then it will correct the problem. So this will become a curative treatment for many conditions which are otherwise non-curable. Say for example, thalassemia and sickle cell are the conditions which affect the red cell, which can be cured with bone marrow transplant. And there is a whole number of primary immunodeficiencies where the white cells are not functioning, where we will have to use the stem cells from a donor so that you can correct the defect. Otherwise, their life is very, very limited. Similarly, there are some platelet disorders like Wiskott-Aldrich syndrome where we will do a transplant to correct the problem. And how do we do it? Usually, this is not a surgical treatment. So we have to be clear. So whenever the word transplant is used, people imagine that it is going to be a surgery. This is not a surgery. This is a medical treatment. And one good thing about the treatment is that compared to other solid organ transplant, the donor actually doesn't lose anything. They have to give some stem cells, which your body will make. So the donor doesn't lose anything. Another important aspect is if the treatment is successful, they will not be on any long-term medications. Whereas as opposed to a solid organ transplant, either liver or kidney transplant, they will have to be on lifelong medication. Whereas bone marrow transplant, when it is successful, you come off every single medication and you live a normal life. And how do we do it? So in order to prepare the patients for the transplant, we may have to give a lot of medications. Most of the medications are similar to the drugs which we use in cancer therapy, or otherwise known as chemotherapy, and some immunosuppressive therapy. So we give these medications to remove the patient's own bone marrow and also reduce the patient's immune system so that they will accept the cells from the donor. And usually the admission will be for about 1.5 months, so 10 to 12 days or 15 days before the transplant and about another 2 weeks, 3 weeks post-transplant. So this is a serious procedure, but it is always used in severe life-threatening conditions. Without this procedure, the patient's life may be very limited or very little chance without this procedure. Lots and lots of people are now benefiting from the bone marrow transplant. At Aster CMI hospital, we have a very experienced team who has done many number of transplant and a full equipped bone marrow transplant unit and nurses. So we will be able to take care of any condition needing this procedure.